How can I prepare for the medical Japanese proficiency test? Hi, I'm Dr. K from Med Insider Japan. I'm a native Japanese graduated from European med school. I'm sharing information for foreign doctors who want to work in Japan. Today, I'd like to tell you about the details of the medical Japanese proficiency test. You can take this exam at the end of September if you successfully finish the application to the Ministry of Health, Labor, and Welfare. It usually takes place in Tokyo, and they want to check your medical Japanese skills in terms of reading, listening, speaking, and writing. They will ask you to do history-taking twice and physical examination once. You need to score 60% to pass this test. The history-taking part takes about 10 minutes. They'll call your name one by one and ask you to enter a room where a mock patient and a mock colleague doctor are waiting. The instructions are given as follows by an audio player on the table. 1. They'll ask you to silently read a paper in which the patient's ID, chief complaint, and vital signs are written. 2. As a next step, you have to read out loud the paper so the examiner can check your pronunciation. 3. Then, you are required to start history taking to the mock patient. Here, you can ask about the history of present illness, past medical history, allergies, medication, and so on. 4. You'll be told to ask the colleague doctor if there are any physical findings of the patient, such as abnormal heart sound, lung sound, or skin color, etc. 5. Lastly, you have to write a medical record about the patient. The physical examination part also takes about 10 minutes. Again, they'll call your name one by one and ask you to enter another room with a mock patient and a mock colleague doctor. The instructions are given as follows by an audio player on the table. 1. They'll ask you to silently read a paper with the patient's ID, chief complaint, vital signs, and history of present illness. 2. As a next step, you have to read out loud the paper so the examiner can check your pronunciation. 3. Then you are required to start a physical examination. It's up to you what to do, such as auscultation, palpitation, percussion, etc. You can use instruments on the table, such as a pen light, tongue depressor, reflex hammer, etc. 4. Lastly, you have to write a medical record based on your findings. You should write a differential diagnosis too. When I took the test, I got a 5-year-old boy with fever and a 20-year-old woman with abdominal pain for the history-taking part, and a 60-year-old male with abdominal pain for the physical examination part. During the exam, everything was recorded with a video camera. It's important to use plain Japanese when you are communicating with a patient, and medical Japanese when you are communicating with a colleague doctor. They don't really check your medical knowledge, but they want to know your Japanese proficiency. Probably it's hard to complete writing medical records in time, but you can use hiragana instead of kanji. I did so too. According to the website of Ministry, you need to score 60% to pass. But I don't know how much score I got in the end because they just sent me a letter which says, you passed. Thank you for watching. I'm going to upload more videos. If you thought it was helpful, please like the video and subscribe to the channel. See you!